Audio recording for this meeting has begun.
All right, so welcome everyone to our second National Program Integrity webinar for the fiscal year, Assessing Program Risk and Identifying Fraud in CCDF. My name is Leanne Bryant. I'm the Program Integrity Manager here at the National Center on Subsidy, Innovation, and Accountability, also known as NICSIA, and I'm going to go ahead and kick us off today. We are going to start with some of our traditional housekeeping items. For those that joined a few minutes early, we did try to get some activities going to help us get to know this newer Adobe Connect platform and typing into the pod. We do encourage interaction and discussion throughout the webinar today, and that might be typing into those chat pods or raising your hand so that we can unmute you on our end. And in order to raise your hand, that icon or button is at the very top of your screen.
I got it, yeah.
I sent an email out earlier today to all registrants that provided a handout of the slide deck, as well as the newest release of our fraud toolkit. But we also have a variety of program integrity related resources available for download in that Program Integrity Resources pod. And that's located at the bottom right side of your screen. Please feel free to download files throughout the webinar today. So due to the large number of participants with us today, we were trying to mute everyone on our end, but we seem to run into some glitches with that. So if you could please mute your line, that would be much appreciated. I am hearing some sidebar conversations going on, so if you could mute your lines. Again, we have 240 participants today. It would be great if we could keep the audio lines as clear as possible. If you should have any issues during the webinar, please reach out to Kara. Her email is provided there on the screen, but it's also located in the chat pod if you should have issues later.
Here, I got a note for you, Mel.
So here are our primary NICSIA presenters for this afternoon's webinar. Anne Renaud Avila is a CCDF Fiscal Management Subject Matter Expert here at NICSIA. And both Janae Broadway and Mike McKenzie are Program Integrity Specialists. Now I'm going to turn it over to Monica Huggins in the Office of Child Care for a brief welcome message. Monica?
Hi, good afternoon, everyone. Thank you, Leanne. This is Monica Huggins with the Office of Child Care, and I just wanted to take this opportunity to thank everyone for being with us this afternoon. We know that program integrity is very important in helping you carry out your responsibility to ensure CCDF program accountability, safeguard funds, maximize benefits for eligible children and families, and spend tax dollars appropriately. This webinar series is part of the ongoing work of the Office of Child Care to help you strengthen your program integrity and accountability efforts. So we really do appreciate all of you. As Leanne said, we have 240 participants on the line, and so that tells us just how important it is for us, but it also tells us how important it is that you feel how important it is on your end as well. These national webinars highlight lead agency strategies to support the use of internal controls and fraud prevention. This is our second webinar series for 2020. In December, we had a webinar and we provided an overview of CCDF program integrity. Today's webinar is based on feedback from December's webinar and provides a deeper dive on assessing program risk and identifying fraud in CCDF. And I would just stop to say that we want to continue to hear from you about what's important so that we can make these webinars that support your efforts and so that you can continue to make program improvements to address program integrity. During today's webinar, we will share tools available to help you assess risk and detect fraud in your programs. We will also highlight specific program integrity state strategies from the most current CCDF plans, and we will hear from North Carolina's lead agency about how they monitor child care provided billing records for program compliance. So again, welcome this afternoon. We hope to have feedback from you about how this webinar was beneficial to you, any insight or input about future webinars that we can provide to support your effort. And at this time, I'm going to turn it back over to the Subsidy Center.
Thank you, Monaquin. Okay, so let's take a quick look at our agenda. We'll start with talking through the importance and benefits of program integrity strategies within your child care programs. Then Mike will lead us through a presentation and discussion on assessing program risk. Janae will discuss identifying fraud and other program violations. And Kim Miller and her team from North Carolina will share their child care assistance program compliance activities and take questions from you all throughout the presentation. We'll finish up today with newly released program integrity resources, including the enforcement and recovery section of the fraud toolkit. And we'll also ensure that you all have the date for our next webinar, and as Monaquin indicated, the opportunity to share how you feel about today's webinar and what we can dig into in future webinars. So that is it for me. I'm going to turn it over to Ann to get us started on our next activity.
Good afternoon, everyone, and thank you so much for joining us. We are going to be doing an activity to get us started today, where in just a moment we will have a word cloud exercise related to CCDF that will pop up on your screen. And in one word, we'd like you to enter what is the first word that you think of when it comes to CCDF. So you can just type your answers in the chat box here, and a word cloud will pop up on the screen.
You have been muted. Your microphone has been turned on. You have been muted. Your microphone has been turned on.
It looks like we're having a little bit of technical issues with our word cloud. I'm not seeing a place for folks to type in. Ann or Janae, are you able to restart it for us real quick, or we'll just go ahead and skip? Oh, there it goes.
There we go.
There we go. Thank
you.
you.
Thanks for your patience. And we'll give it about a minute here for people to enter in words that they think of. So far, the biggest one is children and child. Okay, great. So we'll wrap it up in just a minute here, but as you can see, children, some of the top words are children, funding, child care, assistance, and families. And these are all very important because children and families are who we work to protect. And program integrity includes the processes that we put in place to help ensure that we are supporting children and families in the best way possible, while at the same time protecting taxpayer dollars that support these programs. Some of the other words we might see here are, or that we see here are assistance, compliance, rules, and accountability. And we will be talking a bit about rules and regulations. So thank you for doing that exercise. And we'll go back to the slides now. So we'll talk about program integrity as it relates to values. Program integrity is about the firm adherence to a code of moral values or incorruptibility. It's about doing the right thing even when no one is looking. And program integrity for CCDF is the systems and processes that we put in place to ensure a firm adherence to the regulatory requirements and rules that actually guide the CCDF program. It's important to follow these regulatory requirements for a number of reasons. And you can see here we have the word ethics, and this means that we're ensuring program and provider quality. Taxpayer dollars are being spent appropriately when we have program integrity. It helps families sustain employment and education to become self-sufficient. It reduces fraud, waste, and abuse when we incorporate internal controls. And it also helps conserve financial accountability. And then finally, it safeguards funds to maximize benefits for eligible children and families. Overall, it's about being ethical in the work that you're doing. And there's many benefits to program integrity. So for example, it helps to ensure that correct eligibility determinations are made, that we are making accurate payments and reducing improper payments, and deterring program fraud. It also reduces waste and abuse. And by doing this, we're really protecting the funding that can be used to serve other eligible children and families. So we'll move on now to talk more about program risks and the processes that we can take to ensure program integrity. And as we do so, it's important to keep in mind the values that we've discussed here that guide our work. So now I'm going to turn it over to Mike, who will talk about assessing CCDF program risks.
All right, thank you, Ann, and good afternoon, everyone. I hope you can all hear me okay. I'm going to use the next several slides to provide you with some examples of what some states are doing to assess risk to their CCDF program, according to your most recent state plan submissions. We asked the states we're highlighting here to confirm that we've accurately portrayed what they are doing. We heard back from most but not all of you. So if we say anything about your state that you want to add or correct, just raise your hand in Adobe and we'll bring you into the conversation. Feel free to ask questions anytime during my presentation today. And with that, let's get started with what the federal regs say. "45 CFR 98.68 sub A states that lead agencies are required to describe in their plan effective internal controls that are in place to ensure integrity and accountability while maintaining continuity of services in the CCDF program. It goes on to say that these shall include sound fiscal management, risk assessment, staff and provider training, and regular evaluation of your internal controls." Now today I'm going to focus on strategies related to risk assessment, which is addressed in 8.1.3 of your state plans. This section asks you to describe the processes your agency will use to identify risk in your CCDF program, including supervisory reviews, conducting a risk assessment of policies and procedures, establishing checks and balances to ensure program integrity, and any other strategies that your state uses to identify risk to your program. So let's begin with some states and what they're doing in terms of supervisory reviews. "46 states and territories indicated they use some kind of supervisory review as part of their risk assessment. As we reviewed state responses and considered agencies that we visited, we identified 3 states that we thought you might be interested in hearing more about. In Arizona, The review of eligibility case files to ensure accuracy is conducted by the Quality Assurance and Integrity Administration. An error trends report is distributed to program managers, and it's reviewed by all eligibility supervisors on a monthly basis. In Nebraska, program accuracy specialists, frontline supervisors, and CCDF program specialists review several child care cases monthly and then have monthly meetings to discuss trends and errors, policies, and procedures. Their CCDF policy unit also reviews trends and policy questions, which helps identify if additional training or policy or process tips are needed. In Connecticut, the State Office of Early Childhood, or OEC, contracts with the United Way of Connecticut to administer eligibility. United Way has a dedicated quality assurance unit which reviews cases to ensure accurate eligibility determinations. OEC also conducts monthly case reviews to determine if any family certificates were improperly paid. So as you can see, there are various ways that you can conduct supervisory reviews, and you don't necessarily have to have your supervisors complete them. Another effective way to assess risk to your program is by regularly reviewing CCDF program policies and procedures. Clear policies and procedures make it easier for caseworkers to administer the program, and it also makes it easier for parents and providers to understand their responsibilities of the program. 54 states and territories said they conduct some type of regular assessment of their policies and procedures. The ones we've highlighted here are Maryland, where they complete a risk assessment when new policies and procedures are implemented to determine the potential barriers that case managers may have with consistently implementing these policies. Then, based on that review, the Division of Early Childhood will develop written communications or provide technical assistance as needed. North Carolina, who will talk about their program more in depth shortly, conducts an annual assessment of each local agency using information about the allocation amount, changes in staffing, monitoring results, and findings from single county audits in the previous 2 state fiscal years. Keep in mind, North Carolina is state supervised and locally administered. If you have any questions as we go along here, folks, just raise your hand or enter a question in the chat box for me, okay? Okay, in DC, they use the Grantee Internal Controls Assessment Tool as a framework for reviewing how well the district's policies and procedures meet CCDF requirements in the areas of program integrity and financial accountability. This tool was designed jointly by NICSIA and the Office of Child Care to assist grantees in assessing how well their policies and procedures meet regulatory requirements. It can be used by state and federal managers to evaluate how well a grantee's internal controls are functioning and to determine what, where, and how improvements can be made. "52 agencies indicated they have some level of checks and balances in place to assure program integrity. Now, these checks can include assigning specific roles to staff or building alerts into your support systems to automatically identify potential problems for you. So here's a few strategies we found interesting. In Hawaii, child care subsidy case managers and supervisors who have authority to authorize child care subsidy benefits are not able to issue EBT cards to subsidy families. That function is reserved for admin staff that don't authorize payments. Hawaii also has some system reports that flag potential errors or high-risk actions and collects cumulative data for monthly review, including which cases and subsidy workers may have frequent changes to bank account information, or providers that have their license or registration suspended. Minnesota's eligibility system has security roles and system edits built right into it. The system is programmed with multiple safeguards to track and limit payments for absent days and holidays, and to cap provider payments according to their established policy. In addition, county and tribal workers who administer their program can only hold 2 of 3 primary security roles. Now in Kansas, their eligibility system contains edits that will prevent the authorization of excessive hours, prevent the overlap of plans for the same child at the same time, and it determines the hours to be authorized when schedules are entered to prevent and reduce errors. Warnings are also created when the system recognizes something that requires a closer look by the eligibility worker, like child care plans being created for a provider who's almost at capacity. Provider rates are automated to prevent incorrect rates from being entered into the child care plan. So today, we provided you with just a few examples of the great work that agencies are doing to detect risk in their CCDF programs. We have a few minutes now to discuss anything that's been shared or to talk about other strategies being used out there. So we're interested in what eligibility processes you have in place to detect or prevent fraud or risk to your program. Or tell us about the types of risk assessment strategies you have in place that maybe we haven't talked about today. So feel free to type something in the chat box. Again, if you want to raise your hand, we'll see if we can connect you online as well. So multiple folks are typing right now. As soon as I see what we've got, I'll share that with you. Give me just another few seconds here, folks. People are furiously typing. So what do we got here? North Carolina, Kim Miller says North Carolina Family Accessing Services through Technology is a case management system that does many things that we already mentioned. So thanks for that, Kim. Chris Smith said, in my experience, fraud is more likely to be committed by providers rather than families. That's a good point. We know that there's a lot of money to be recouped on that end as well. Thanks for that, Chris. We'll give people just a little while longer to see what else we get here. We hear from Tracy, who says we have eligibility interviewers who meet with applicants and request copies of pay stubs and other relevant documents. We also cross-check with other state databases. Great practice. And Mary Ellen says NYS utilizes a front-end detection system or feds to highlight potential fraud indicators. Lisa Ellis from Indiana says Indiana has a 100% monitoring system. So these are all great examples of risk assessment, folks. Thank you for sharing this information. Sorry we couldn't highlight everybody's activities today. All right, we're going to go about another 30 seconds and then keep the presentation going. Thank you, Sam. Sam says we have a group that reviews cases from each worker every 6 months. We also have frequent quality checks that occur at the supervisory and management level. And Susan indicates that California provides webinars, training to field, technical assistance, internal and external training to contractors on all eligibility issues. Finally, Jen Butler says we have both internal and external eligibility monitoring processes which help assess risk and potential fraud. Lots of great contributions here, folks. Thank you for sharing this. Just a couple more quickly. Josh Lamb says separation of duties by eligibility workers, which we talked about, invoice processors, level 1 and level 2 case reviews. So, and Eric from Vermont. Vermont does a lot more upfront reviews of new cases coming into our eligibility agencies, so errors are caught before they become problems. Great way to approach it. We utilize a case review checklist for every new application. So thank you again for all of your contributions. These are great ideas, and as we put together our summary of today's presentation, we'll be sure to share everything that everybody has provided to us. All right, with that, thank you for your contributions in addition to what we presented today. And now I'm going to turn it over to Janae Broadway. She's going to share some strategies related to identifying CCDF fraud and other program violations with you from Section 8.1.4 of your state plans. Thanks, Janae.
There we go. Thank you. I was still muted. Well, welcome everyone, and as Mike said, my name is Janae, and I'd like to thank you guys for joining us, taking time out of your busy days today to discuss these important items when it comes to program integrity and CCDF. So as Mike stated, we'll discuss now identifying fraud, CCDF fraud, and other program violations. So as Mike did before, we'll start with the federal regulations in the Federal Regulations Program Integrity at 9868B, where it states lead agencies are required in their plan to describe the processes that are in place to identify fraud and other violations and other program violations. And the federal government actually provided a few processes or strategies, and we have them listed here on the screen. So that's record matching and database linkages, review of attendance and billing records, and quality control or quality assurance reviews. Now, along with these processes, we've also identified additional effective strategies that may be used by a lead agency, which include, there we go, clearly defining fraud and or intentional program violations. Now, we may ask, why is this important? Well, in order for staff to identify fraud or a program violation, they need to know what constitutes fraud or a program violation at the lead agency. Next, we have auditing provider records, and this is separate from the attendance and billing records or invoices. We're talking about conducting additional investigative practices that dig deeper, a little deeper, to locate information such as shadow owners, especially those shadow owners that have been sanctioned from the CCDF program by the lead agency. In addition, we have providing staff a fraud manual or desk guide, using the administrative data the lead agency already possesses for data mining, sharing, or analytics. Training, and I heard a lot of you guys say this earlier, well, a few of you, training eligibility staff on front-end detection, and this is things such as reviewing check stubs or documents or even interviewing techniques, and establishing characteristics for red flag reports and system alerts. Now, I'd like to point out that an advantage of having system alerts is that they can provide real-time data either before application processing or during application processing. And this will alleviate for some of those lead agencies improper payments. Now, an example of a system alert could be a provider's residential address and a child's residential address are the same. This would be an additional alert or an established alert to notify the agency or eligibility worker of potential fraud or a program violation. Now, given the information in your CCDF plans, the 2019-2021, most of you guys have already incorporated a lot of these additional procedures. So let's see how some of the states have implemented some of these. And we'll begin here with the clear definition of fraud or program violation. Now, before I start here, I'd like to reiterate what Mike stated earlier. If you see your state strategy or your state being highlighted and you want to add something or point something out or comment, by all means, either raise your hand to be unmuted or just type something in the chat box so that we can recognize you. We want to stress the importance of hearing from you guys, and we know that you like to hear from each other. So on the screen, we have the verbiage pulled on how Louisiana and Texas define fraud. The verbiage in each definition is similar yet different. If we peel back a layer, we can see the characteristics in the definitions are the same. So let's have a look. For Louisiana, they indicate any act of fraud, such as the submission of false or altered documents or information, intentionally making a false or misleading statement, or misrepresenting, concealing, or withholding relevant facts. Whereas Texas indicates an individual commits fraud if to obtain or increase a benefit or other payment, either for the individual or for another individual, he or she does either the following: makes a false statement or representation knowing it to be false, or knowingly fails to disclose a material fact. Now, the standout in these two definitions here with Texas and Louisiana includes the terms payment and benefits. Now, while Louisiana does not have that specific verbiage, their statements are a coverall and could be applied to payments and benefits. In either case, the states have clearly defined what constitutes fraud, which will assist staff in identifying fraud, right? So now let's look at how your peers are implementing other strategies. Let's move to red flag reports. Now, before I start here, the next few slides, as Mike indicated, will contain information extracted from the state submitted 2019-2021 CCDF State Plan, Section 8.1.4A, that asks the states to describe activities or all activities they are engaged in to identify and prevent fraud or other program violations to ensure program integrity. Now, second part to this state plan response was to include the results of the activity. Now, we didn't see a whole lot of this information related to the results, but we did see those activity response. So just a quick note for you all, when you're thinking about the results of the program integrity strategies for your states, to get you to think about those results from those program integrity strategies. Let me try that again. So when you get to thinking about completing your next CCDF state plan and you're entering in those descriptions, you may want to get to thinking about those results now so that you are able to enter that information when it's time. Okay, So now let's look at Vermont and India and what they presented to us as it relates to the red flag reports. All right. So Indiana, utilizes two systems to run a variety of QA reports or quality assurance reports. The systems they are using are called the Child Care Information System and the Electronic Attendance System to identify fraud and administrative errors. Whereas Vermont also utilizes a system to generate red flag reports called the Bright Futures Information System, or BFIS. This system reports to the lead agency instances of children above licensed capacity as a provider, children with multiple providers, and providers with high subsidy payments. Now, both are great examples of using administrative data the lead agency already possesses to identify fraud and or other program violations through data mining. Now let's look at attendance and billing records. Now here we see there were 49 lead agencies who reported in their plan to use attendance and billing records to identify fraud and other program violations, but today we'll quickly look at Texas and Wyoming. We see here Texas reviews attendance on each billing cycle and also has an independent audit provider, Texas Workforce Commission Subrecipient Monitoring Department, to conduct additional reviews. And Wyoming has the fiscal staff review all child care invoices submitted by providers, and they have another fiscal staff enter in billing information into the payment system for payment. So here we see that separation of job duties and checks and balance, which are very effective ways to identify fraud and other program violations, and are also strengths to internal controls and proper oversight of CCDF funding. Now let's look at quality assurance strategies. All right, so here we see Utah. Our states that we highlighted here are Utah and Washington. And here we see that Utah continues to conduct case reviews in the same manner as the error rate review process every year. This is an activity we see at the Subsidy Center gaining popularity among states. While Washington conducts reviews on provider payments and their DSHS supervisors review all subsidy determinations on new eligibility staff, and to that staff reaches a point they can make a determination without errors. Now, these types of strategies are good ways to identify fraud and other program violations that actually work in the program interest to decrease administrative errors and improper payments. Now let's look at some other strategies that were provided by your peers. So while we had 23 lead agencies that responded to this, what we'll highlight, the states that we're highlighting today are North Dakota and Tennessee. In North Dakota, they have a program policy staff to conduct a review on intentional program violations submitted by other subsidy programs such as SNAP and TANF to see if that IPV is applicable to CCDF program. And in Tennessee, the Office of Inspector General investigates the fraud and intentional program violations while the CCDF program staff, fiscal staff, and legal coordinate with the AG's office. So these two strategies, the reason for me us pulling these out were due to the communication and coordination amongst agencies, which can prove to be very valuable within CCDF administration, especially in cases of fraud and other program violations. So I know that I've provided to you guys a lot of good information and you've seen what your other peers are doing, so let's talk about it. Would anyone like to share with the group either other strategies to identify fraud or program violations, or share with the group techniques used by the agency to establish fraud or program violations? Now, we know that there are additional strategies out there and techniques from reading the state plans and in working in state government, and I'm sure the states would love to hear from one another. So let's share.
Hey, Janae, this is Mike.
Yes, sir.
And we had a question from Carol, I believe from Massachusetts saying that their AGO stated that they could use the term knowingly, or that they could not use the term knowingly when defining fraud. And Carol was wondering how other states will handle that.
Okay. Do we
So
have...
if anybody's got anything to add, you can either type it in or, again, raise your hand. So just wanted to add that. Thank you.
Thank you, Mike, and thank you, Carol. So I would love, if Texas or Louisiana is on the phone, I'd love for them to take a stab at addressing Carol's question if possible. Or if any other states are on the phone and they have the verbiage knowingly in their definition for fraud, would like to share. And Gordon Snow says, Utah does not use knowingly in our definition. Would either Carol or Gordon like to share, if we could take you off mute, if you want to raise your hand or just say yes, and tell us your definition, or type it in the chat box, whichever you feel most comfortable with. We got a few people typing, so we'll just continue to wait here, guys.
Remember, you can also raise your hand and we'll unmute you.
Yeah. Ooh, a lot just came in. Well, anyone else who wants to provide their definition of fraud or how the lead agency establishes fraud? There we go. James says fraud means an intentional deception or misrepresentation made by a person with the knowledge that the deception could result in some authorized benefit to himself or herself or to another person. Eric Post indicates Vermont's fraud statute begins a person who knowingly fails by false statement, misrepresentation, impersonation, or other fraudulent means to disclose a material fact used to determine whether that person is qualified to receive aid or benefits under a state or federally funded assistance program, or who knowingly fails to disclose a change in circumstances in order to obtain or continue to receive aid or benefits to which he or she is not entitled, or in the amount larger than that to which he or she is entitled, or who knowingly aids and abets another person in the commission of any such act. So Eric, if we take you, do you want to share with the group how Vermont established that fraud definition? Okay. All right, no problem. And usually it goes through, and I like to point out, when it comes to the statutes from a state level, it usually has to go through a legal process within that state, especially within that agency, especially with definitions such as fraud. So we'll go to Ms. Yvonne here. She says the term fraud has been legally defined and is an intentional false representation of a truth or matter of fact, whether by words or by conduct, by false or misleading allegations, or by concealment of that which should have been disclosed for the purposes of including another reliance upon it to part with some valuable thing or surrender a legal right. And Carol here states the definition is providing false or misleading information or documentation to EEC or a subsidy administrator for the purposes of establishing or maintaining eligibility or increasing the level of child care assistance that has been verified as false or misleading by EEC or a subsidy administrator, or the concealing or withholding of information for the purpose of establishing or maintaining eligibility or increasing the level of child care assistance as determined by the Bureau of Special Investigations, BSI. And I believe you were in Massachusetts, correct? And we have not reported a change within 10 days after the change occurs, and this individual knew they were supposed, okay, are we going, I think my chat box, oh, that's all of yours, Gwendolyn Snow. So any person, including a child care provider who obtains or attempts to obtain public assistance or otherwise intentionally breaches any program rule, either personally or through a representative, is guilty of intentional program violation, and then it goes on to list what acts this constitutes an IPV. And then Julie Anderson indicates any program participant that has falsified his or her application or documentation or has otherwise abused the program. These are all great. Thank you guys so much for this information. And as Mike stated, we'll gather all of this information to make it available to you guys for review at a later time. But for the interest of time, we'll keep it moving. And I'll now turn it over to Kim Miller to talk about their state compliance activities. Kim is the Senior Subsidy Compliance Manager in the Subsidy Service Section at North Carolina Department of Health and Human Services, Division of Child Development and Early Education. Kim? Kim, are you there?
Kim, we're not hearing you. You are not muted on our end.
Hello, this is Kim.
There you go.
You guys hear me now?
We can, Kim.
Yes.
Excellent. Okay, so thank you for inviting us to present today. I'm going to be trying to move the slides. We're going to see how that goes. I did practice this, so let's go to the next slide. So I've already been announced and introduced, and that's quite a mouthful, but our subsidized child care assistance program does live within the Division of Child Development and Early Education in Health and Human Services in North Carolina. So we're going to talk to you today about how we implement 8.1.4, which is our program integrity piece, of course. We are a state-supervised, county-administered program, which has already been mentioned before. We have a subrecipient relationship with our counties. We have 100 counties and 2 subcontractors that we call LPAs, Local Purchasing Agency, and they are allocated funds based on a legislatively mandated formula that we use to allocate our CCDF dollars. So just to give you an idea of our size of what we're looking at program integrity for, is in December of 2019, 3,812 child care providers received a subsidy payment. That includes homes and child care centers. And we served 60,697 children. We usually count children, not cases. And as was mentioned before, we would like to answer questions as we get to little breaks in our presentation. So the 2 people that are presenting with me today are Wanda Hopkins and Jennifer Brocious. These are lead workers for our programs. And I'm going to go forward now and just give you a little bit about our O-chart. So you see it here. And subsidy services is part of the division. We also have regulatory services. We also have a admin section that is all the behind-the-scenes work, all the budget work that goes on, contract works for quality dollars, all of that. And in our regulatory services, that's all of our health and safety. So we are all in the same organization. So in our subsidy section, we have a policy unit. And in our policy unit, we have a manager, a lead, a systems liaison, and 3 consultants. In our TA unit there, branch, we call them units, but I think if you really looked at the chart, I think they would be branches. We go back and forth. But they share a manager with the policy. There's a supervisor and 6 consultants and technical assistants. And this is technical assistance to county departments of social services in their implementation of the program. And then when we get to compliance, I've divided that up for you into program and provider. And program has a lead and 4 consultants. That is going to be Wanda, and she's going to talk to you about her program part. And then for provider, that's when we're looking at child care billing records. We have our lead, Jennifer Brocious. She has 4 consultants. And then we also have an auditor and an admin officer who handles all of our tracking, corrections, and PI communications. And then to support us in all of this, we do have a data manager, and of course I have an assistant that helps us with all manner of things. So that is where we are with that. This is our history, and I'm going to turn this over to Wanda and let her talk about program compliance.
Thank you, Kim. Good afternoon. Can everyone hear me?
We can. Yes.
Okay, thank you. So I want to elaborate a little bit more on what Kim was saying about our program compliance unit. Our program compliance unit started in 2000, and that was as a result of an identified need for increased accountability and oversight of both our federal and state requirements. And essentially the main goal of our unit is to maximize compliance with those state and federal policies, rules, and regulations. As Kim shared, our unit is organized with a manager, senior subsidy manager, that is Kim Miller, and we have 4 field-based program compliance consultants. And Ms. Miller and her administrative assistant are based in the division office in Raleigh, North Carolina. Each of the 4 consultants has a territory of 25 counties, and in those assigned counties, the consultant serves as the team lead during monitoring processes for those counties. The structure of the unit really didn't change much until February of 2018, when management identified a growing need for additional leadership and coordination of activities. That's when my position was added, the lead worker position. Just a few of the state-level functions that position's responsible for would include facilitating monitoring schedule development, maintaining statistics, implementing various projects, helping implement the improper payments review, program development, and there's lots more. But that position was added in 2018. And then as Kim mentioned earlier, we do share an administrative assistance with the provider compliance team, and also we share a data manager with that team. And they help with monitoring samples, reports, and tracking. Okay, next slide. So a little bit about the functions of the program compliance unit. We are responsible for monitoring all local purchasing agencies to assess compliance with state and federal requirements. And we do that by conducting on-site reviews at each local purchasing agency at least once every 3 years. Any errors that we find during the monitoring process require financial and/or documentation corrections, depending on the type of error. And the specific functions of our unit are to standardize monitoring procedures utilized across the state, establish performance improvement plans, minimize audit exceptions at the local level, and achieve a high-quality service delivery while identifying training needs. Okay, next slide. So a little more details about our processes and how we monitor. So each agency that administers the subsidized child care program
is monitored once every 3 years. The scheduled month is provided to the management of the local purchasing agency prior to the beginning of the state fiscal year in which the agency will be monitored. And then closer to the actual visit, they're provided more specific dates and times. The consultants review a sample of records for each, the consultants review a sample of records for the service month, which is 2 months prior to the month the visit occurs. So, for example, if they're monitoring in March, if they're completing a visit on site in March, they're monitoring the January service month. And they monitor the records which represent 6% of the children served by that particular agency. So the sample of records reviewed has a floor of 5 records and the ceiling of 150 records. So we always review at least 5, depending on the number of children served, is 6%, up to a maximum of 150 records during the on-site visit. If more than 30 records are to be reviewed, other consultants are assigned for each additional 30 records. So one consultant is expected to review 30 records at each visit. Prior to the visit, the agency will complete a
Wanda.
Somehow I was muted. I didn't do that. Can you hear me now?
Mm-hmm.
Okay. So prior to the visits, the agency will complete a worksheet to provide information regarding roles and responsibilities of agency staff, policies, and procedures. And during the visit, a monitoring checklist is completed for each record. And that checklist, we use that to evaluate the record and case management, including their initial eligibility decisions and redeterminations. The local purchasing agency is required to make corrections, again, for both documentation and financial errors, and an error affecting a payment must be corrected if it is more than $1. After the agency receives their report and makes corrections, the Senior Subsidy Compliance Manager provides the agency with a finalization letter. Next slide, please. So the report that the agency receives includes 4 main sections: scope and content, findings, observations, and follow-up procedures. And the report is developed by the team leader, and it goes through a peer review process and a management review process. So approximately 90 days after the conclusion of the on-site monitoring visit, the monitoring report is provided to the agency, and they have to respond within 45 days with their plan for correction. An initial compliance score is included in the report, and we do that by aggregating data from the monitoring checklist. We consider an agency in compliance if their score is at least 95%. And each record cited in the report is cited using a sample number and includes a narrative description of why the report was marked in error. And also in our agency, consultants communicate with our technical assistance unit so that that team can follow up to provide training and help with improvement activities, especially when an agency is not in compliance. When corrections are required, the agency submits verification of completion of all financial and documentation corrections no later than 1 day of monitoring. And regular communication is required to ensure the corrections are made as timely as possible.
Yeah, I think I remember the pink one. It was like a light pink.
For corrections resulting in overpayments, those come out of county funds, and any underpayments come out of the agency's allocations. So that is a high-level overview of the Program Compliance Unit. Thank you for listening. Are there any questions for me?
Bye-bye.
Someone
Yes,
is
Wanda,
not
I have a
on
question.
Yes,
This is
if
Scott
Scott
Henney
is on the
from
phone,
Tennessee.
can you please mute your line? Scott?
Okay, can you hear me?
Yes.
Okay, like my question was, the monitoring reviews, is it primarily fiscal or programmatic or both? I know you mentioned like reviewing 30 different types of documents, and also the other question is both. And is your review based on the agreement that you have between the program and the provider, or is it within the rules promulgated, or both?
All of that. We look from eligibility, initial eligibility. We look at the income that was used to determine eligibility, verifications used to ensure the income that's used was correct. So we're looking at eligibility, verifications, and evidence. When we consider both the provider agreement, but policy, the laws, rules, and policies govern the subsidized child care assistance program.
Okay, thank you.
You're welcome.
Okay, this is Kim. Are we ready to move to provider compliance? Jen, are you there?
I'm here. Can you hear me?
We can.
Okay. Good afternoon. As Kim said, I'm Jennifer Brocious, and I'm the Provider Compliance Lead Worker, and I'm going to provide you a brief overview of our unit. The Provider Compliance Unit was established in 2016. This was in response to the CCDF Act of 2014, which emphasized program integrity. The activities of the unit are based in the NC Administrative Code and CCDF requirements. The unit was formed in June 2016 with 4 field-based consultants and an administrative officer. In February 2017, the lead worker and auditor were also added to the unit. The primary focus of the unit is to monitor the 3,812 child care providers that receive subsidized child care assistance payments for compliance with the program requirements. Okay. The major functions of our unit are random visits, referral investigations, technical assistance, high-risk assessments, and tracking. Our random visits occur monthly, and a sample of 32 child care providers across North Carolina are selected for this visit each month. The provider is notified via email of the visit so they can gather documents for the consultant's review. The actual day is not announced to them, but the month is shared with the provider. The consultant visits the provider to evaluate provider records for accuracy using a checklist. The items evaluated are the attendance records, which are compared to entries in NC-FAST using an Excel document. The provider's private pay rates are also evaluated to ensure the provider is not charging private pay parents less than subsidy. The provider's policies are also reviewed during the visit. Referral investigations originate from DCDE licensing enforcement, random visits that have an error rate greater than 10%, the LPAs, which administer the Subsidized Child Care Assistance Program, the Office of the Internal Auditor, and the CACFP program. High-risk assessments are evaluated by the auditor. They are generally in response to regulatory actions that have been identified with attendance issues. The auditor then requests attendance records and performs a desk evaluation. Once that's complete, a report is mailed to the provider. The auditor also receives a report each month indicating which providers submit all present and NC-FAST for a period of 3 months, 3 consecutive months. Provider compliance also provides technical assistance at the request of an LPA or provider. TA is also provided when a provider is not in compliance with program requirements. The technical assistance may include a review of rules pertaining to attendance tracking, sharing samples of attendance documents, viewing training materials in the NC-FAST provider portal, or a review of the NC Department of Health and Human Services Subsidized Child Care Assistance Program Agreement. A provider is issued a determination of noncompliance if their error rate exceeds 10% or if they are in violation of the provider agreement. Implications of a first notice of noncompliance action include a corrective action plan, which the consultant works with the provider to bring the provider into compliance with program requirements, and a potential overpayment issued by the LPA in which a provider received payment in which they were not eligible for. A second instance of noncompliance, the provider would be issued a corrective action plan. They would not be allowed to enroll any new children for a year, and a potential overpayment.
Oops. Sorry, Jen.
The third instance of noncompliance, the provider would be terminated and permanently ineligible for the subsidized program, and there would be a potential overpayment. Are there any questions so far? Okay, then I'll move it back to Kim for to discuss our sanctions.
Okay, thanks, Jen, for doing that. Provider sanctions, we do sanction providers for fraud, and we have 2 ways. One way is the obvious determination of fraudulent misrepresentation. The other way is if the payment error rate exceeds 10%. So what we're doing here is if we do have an overpayment that comes about as one of these evaluations and it's non-compliant, we compare the overpayment amount to the correct payment and the payment that was actually made, and we crunch those numbers together and determine if the provider received more than 10% above what they should have received. If in fact they have, then they are sanctioned. That is in our rule, that if they have received 10% more monies than they were entitled to receive, they are sanctioned. And that is a shall, not a may. We are starting slowly with this. This rule came into be. It's our Rule 0308, and we're going to tell you how to get to our rules at the end of the presentation. This rule was readopted in April 1 of 2019 with very substantial changes. So we are slowly implementing this, doing provider notification and provider training. We talk about if it's determined fraudulent, sanctions can be taken now by the LPA, and I saw a question come up, local purchasing agency. We call them local purchasing agencies because they're at the county, or they're contractors generally with a county at the local level, and they purchase child care services from providers through us, through the allocation from the county. So I don't know if that helps. Historically, it's always been the LPA, but DCD was added with the readoption of the rule, and if DCD issues a sanction, we must do prior notice. So we give the provider an opportunity to submit information to us, asking us to reconsider any facts or information that they have. I will tell you that we haven't been down this road yet with a provider. Again, we're going slowly, as I said, and so we're not quite there yet. Implications of this is a repayment. The funds always have to be repaid. The provider is permanently ineligible if they are determined fraudulent. It does attach to a new facility, so if an individual or group of individuals owns a facility that has a sanction on it, and they try to get another facility, they can, one, be denied a license because of that, but two, if they do get a license, then that sanction for subsidy continues on to that new facility, and they may not accept subsidy. The other thing, the fourth thing that was interesting in this new rule, readopted, very changed rule, is that we may include an operator who is not an owner. So what we're talking about there, operator for us is like a person who's an administrator, a director, anyone that's really left in the operation of the child care facility. So this could be someone who is entering attendance in NCFAST, who is identified as a bad actor, could be sanctioned for doing so, and then that individual would not be able to do that anymore. So we are trying to make sure that we have the people who are following the rules in our program, and we are trying to weed out the people who do not. But as I said, this is a relatively new rule, and it's beefed up quite a bit, and we're hoping to see this through. Probably be a lot of questions on this at the end here. So this is how you can contact us. Wanda is in the eastern part of the state, and Jen is in the western part of the state, so I really appreciate them joining us, as we're a remote group here today, and I appreciate their assistance. On our website, we gave you the website at the bottom, and I am going to tell you how to get to our rules, because it's a little deep in there. You select services, then child care rule, law, and public information, and then rules and law, and then we are the last thing in the list, subsidy rules. And then our state plan is under the same services menu, if you would want to look at the rest of what we've said, and it is under Child Care and Development Fund, and it is the third item in that list. So you do have to go down through services to get to our rules and our laws and everything. So are there questions about the sanction piece or any other pieces?
Mike, do you want to walk through some of the questions that came in the chat box?
Kim, I don't know if you noticed, but there were quite a few questions that were coming in the chat boxes as y'all were talking. There's a few about the checklist, like what sort of things are on the checklist, and they wondered if folks could get a copy of that.
Elizabeth is our assistant director. She's on the line. We will have to decide if we can send out a copy of that. It is a working internal document. We do share it with our agencies, so
okay.
We'll probably share that. It is a checklist in a spreadsheet format. We look at different sections of the record. As Wanda was talking about, we look at is the application present and signed? Is the redetermination present and signed? Was it reviewed timely? Was the income verification present? Was the verified income present within the guideline? I was on a roll there for a minute. We look at the voucher. Was the voucher executed by the provider and the parent? We look at anything like school schedules, any other needs that a family has. In North Carolina, we have 5 needs because we do have state funding for some of our needs. So we look at if they meet the need that they've requested care and are receiving care for. We look at the level of care, the number of hours that they're receiving. We look at the plan of care, which to us is like I need it for employment, because I work from 7 to 4. That's the plan of care. For us, the level of care is then 7 to 4 works out to a number of hours that equates to our percent for the level of care. We look at that. We look at if the voucher is accepted in our portal by the provider within the 60 days. That's required. Oh, Elizabeth is gone. Okay. So those are the types of things that we look at. We look at the narrative documentation. We do expect all the narrative to be in the record in certain places. We do our automated system, our case management system is where we do these reviews because everything is in NCFAS. So we are looking in certain places to see the narrative documentation that tells the story of the case. So that is programmed, concentrates on that, and we review about, I think Wanda has some numbers if your connection is still good, 907 records so far this year. I think we've made 22 visits this year so far, and we've read about close to 1,000 records. So we're out reading records. People are out overnight once or twice a month reading records. And then when does the clock start? Okay.
So, and it looks like Wanda has been replying to a number of questions as folks are posting them. So thank you for that, Wanda.
Okay.
And if people want to ask you about the checklist, can they just reach out to you via your email address?
I will let you and Leanne know about how we can disseminate that.
Great.
It's not pretty. I mean, it's a spreadsheet. You know, it's not anything pretty. It has documentation behind it of what we're looking for, but it is just really a spreadsheet. But we'll make sure.
Okay, thank you. And thank you, Wanda, for replying to the other questions. It looks like you've handled most of those. So again, I think for the sake of time, we only have about 10 minutes left. I want to thank Kim and Wanda and Jen. Thank you so much for sharing your information today. And if folks have other questions, we know where to send them.
Yep. Thanks
for
having us.
Yeah. Thank you for that. We want to hand it back over to Janae quickly to just make folks aware of some program integrity resources that are available. So with that, Janae, I'm going to go ahead and do that. And folks, feel free to continue to type in the chat box if you have other questions, and we'll make sure that answers are provided one way or another. Thanks again, Kim, Wanda, and Jen.
All right, awesome. A lot of good information today. So as Mike stated, I'll quickly go over some program integrity resources with you guys, and then I'll transfer it. I'll turn it over to Ann for a closeout and evaluation. Sorry, I'm tongue-tied today. So let's get into those program integrity resources. For those who are unfamiliar, we have available to the lead agencies at request the CCDF Fraud Toolkit assessment sections, which I'll talk about a little bit more in a second, but the current assessment sections available at request are the fraud risk assessment, the prevention assessment, detection assessment, and now the newly released enforcement and recovery section. We also have available the Fraud Toolkit training, and it's available for download here in Adobe. And states can also request a one-on-one training. And lastly, we have the Program Integrity Data Mining, Sharing, Analytics resource, which is available to states who are interested in understanding the benefits of using that administrative data the agency already possesses. So on your screen now, you'll see the link to NCCIA's Program Integrity Resources landing page, and you'll find a lot of our resources either here on the NCCIA page, or it'll send you a link or transfer you to a different landing page, like for the error rate. There's a lot of information there available, and a lot of you guys are in your error rate review process, so we do have information available there as well. Let's talk a bit here about the CCDF fraud toolkit. So the toolkit is designed to assist lead agencies in increasing their program integrity and accountability while decreasing potential fraud. Unfortunately, the assessment, the actual session has to be requested through NICSIA, and that's the email address to request all or any one of the assessment sections. In addition, there's a link here where you can go and view and read the fraud toolkit, the CCDF fraud toolkit instructions. All right, so let's talk about the newly released as of January 2020, the Enforcement and Recovery Assessment section. In this assessment section, there are 5 categories. These categories will guide the users through an internal evaluation of their administration operations related to CCDF, and those categories include regulations, procedures, and coordination, appeals and adjudicating, improper payments, recovery, sanctions, and penalties. Once you request the toolkit and you receive it, you'll receive a workbook that will be designed similar to what you see on your screen, and it'll have 2 worksheets within the workbook. One is the questions tabs, and the other is the results tab. Let's see here. So on the first worksheet labeled questions, users will have to answer a series of questions related to the 5 categories mentioned earlier. The user has the option of choosing yes, no, or I don't know to each question. Once a question is answered, a risk level and recommendation will auto-populate for that question. Now, after the user has answered all the questions within the assessment, he or she will then go to a second tab labeled the Results tab. And when you're on the Results tab, this will appear on your screen. Now, this worksheet will automatically populate or auto-populate the information on the Results tab based on the questions, the answers to the questions on the Questions tab. The results summary provides an overview of the risk areas and risk levels of the lead agencies. Now, this document is an internal document for lead agencies, but lead agencies may request TA based on the results of the document at any time. We won't have a chance to go through a demo of the actual tool today, but again, you guys can request a 101 or a demo of the CCDF fraud toolkit. And with that, I think we'll end the session here on newly released resources, and I will turn it over to Ann. Thank you guys for your time.
Great, thank you. Well, we've had a lot of great questions coming in the chat box, but if anybody has any questions, we have about 5 minutes left, and then we have an evaluation, and we want to talk about next steps. So if you have any questions, you can feel free to put them in the chat box, or if you'd like to unmute yourselves at this point, you can ask questions as well. So we'll give you a minute for that. Okay. Well, so we'll talk about, if you do have other questions, just feel free to put them in the chat boxes, and if we can't get to them by the end of the webinar, we'll get back to you on them. But just to talk quickly about what's next, we are planning to do a program integrity webinar series throughout fiscal year 2020, and we're looking for ideas for future presentations. So we do have an evaluation that will pop up on your screen shortly. And just don't close your browser. You can actually put the feedback directly in there. And if you have feedback on today's session as well as ideas on future topics, you can go ahead and put that in there. And our next webinar is June 9th from 3 to 4:30 p.m. So now we'll put the evaluation up, and we thank you so much for joining us today and have really enjoyed the discussion.
We're going to go ahead and open up those polls for you folks. 3 questions. for you to provide us with. What program integrity topics would you like to learn about in future webinars? Would you like to showcase your state's program integrity or fraud prevention efforts in any way? And if so, let us provide us with some contact information. Or if you have any other comments about the webinar today, suggestions for future webinars, or questions for us or for any of our presenters that we weren't able to answer earlier, please enter them here and we'll make sure that we get back to you. And we will leave this open for just a while so that folks can take their time and provide your answers.
This is Leanne again. Just want to thank everyone for taking time out of your day this afternoon to spend with us. Again, we'd love to hear your feedback for future webinars. And I know we had some audio issues today. Very unfortunate, but I can promise you we will work to get those resolved for future webinars. But love to hear from you. Let us know what you're thinking and what webinars you'd like to hear about in the future.